Hi there, my name is Dr. Mashhood Qazi. I'm a consultant in emergency medicine and a public health specialist. So a lot of candidates ask about what is the MRCEM OSCE. So one OSCE exam is one of the most important exams, especially at the MRCEM level, because if you're successful in passing the OSCE exam, you start working at a very senior level, for example, a registrar or a middle grade. And so in some cases, you can start working as a locum consultant in the emergency department. So the importance of OSCE exam is essential because it's a life-changing exam. But the advantage of OSCE exam is you already know what's going to come in your MRCEM OSCE. It's going to be 16 to 18 stations. You know there are going to be a couple of history stations. There's definitely going to be a psychiatry station. There's definitely going to be a Breaking Bad news station. There's going to be a couple of resuscitation stations, including ATLS and adult cardiac support or pediatric life support cases. So you know these cases are coming. And recently what we've seen, the trend is slightly changing towards the managerial type of questions and scenarios. Because once you pass the MRCEM OSCE, the college or the Royal College expects you to work at a senior level, just second to the consultant in charge. So working at the senior level has its own challenges. For example, you should be able to manage a busy emergency department. If its waiting room is full of patients, you should know what are the protocols in place, how to deal with complaints. For example, if it's a major incident declared, how are you going to manage an emergency department? How are you going to manage the flow of patients if the department flow is stagnant? So all these things do come up in MRCEM OSCE exams. So managerial part of the MRCEM OSCE has become an integral part. Let's talk about history stations. History stations are the same histories which you have been doing since your medical school, but what has changed is the change that you need to talk about the differential diagnosis, management plan to the patient, and also explain in detail what you're thinking of, what are the concerns, what are the expectations of the patients. I mean, these are the fine lines, fine details you need to now think about when you're appearing in the MRCEM OSCE. The more you practice, and if you the more, it's not about practicing, it's about practicing in the right manner, knowing what your weaknesses are, um, working on your weaknesses, and being told what the right way to approach in an OSCE exam is. For example, I mean, they're not, the Royal College is not focused on checking your clinical knowledge because they've already checked it. What they are more focused on is checking how you are clinically as a doctor, how you can build a rapport or relationship with your patient, how you can deal with the patient complaints, how you can satisfy them with their concerns. So this is what the basic ethos of MRCEM OSCE is. Hopefully, whoever is appearing in the MRCEM OSCE, best of luck, and just keep practicing in the right manner. You will ace the exam, no doubt about it. Okay, best of luck. Thank you.